Have you ever forgotten where you placed your keys or felt a little unsteady on your feet and brushed it off as just getting older? What if those subtle signs were something more? Something invisible, creeping quietly into your brain without warning. That's the unsettling truth about silent strokes, a medical condition that affects millions, particularly older women, yet remains dangerously underdiagnosed. Unlike major strokes that cause slurred speech or facial drooping, silent strokes often show no obvious signs at all, but their impact is anything but silent. In fact, according to the American Stroke Association, more than 1 in 4 people over the age of 80 have experienced a silent stroke, and many of them never knew it. For women, the risk is even greater due to unique biological and social factors that we'll explore in later sections. So, what exactly is a silent stroke? In simple terms, a silent stroke is a small blockage in the blood vessels of the brain, just like a regular stroke. But it affects areas that don't control vital functions like speech or movement. That's why it doesn't trigger the classic warning signs we usually associate with a stroke. Instead, the damage shows up in more subtle ways: forgetfulness, slight changes in personality, minor balance problems. These tiny disruptions can easily be mistaken for just aging, but they are in fact small portions of the brain silently dying due to lack of oxygen. The tragedy is that most people don't discover a silent stroke until they have a brain scan for another reason, or worse, until they suffer a major stroke and the older damage is revealed. Why is it called silent? The term silent doesn't mean harmless. It simply means the stroke didn't produce any immediate recognizable symptoms. But make no mistake, silent strokes cause real brain injury. Over time, they can accumulate, leading to more serious cognitive decline, mobility issues, or even vascular dementia. Many doctors now believe silent strokes are a major underlying cause of memory problems in older adults. And since they often go unnoticed, they aren't treated or prevented, allowing the damage to build up year after year. Why should women over 50 pay special attention? Because of hormonal changes after menopause, women face higher risks of vascular problems, including blood clots and arterial damage. Add to that the fact that women tend to live longer than men and are less likely to seek urgent care for unusual symptoms, and the danger becomes even more real. But the good news is, silent strokes are preventable, and even if you've already had one, there are ways to reduce your risk of having more. This series will guide you through that journey with simple, practical steps. Welcome back to the channel. Today we will explore a very important topic for health, especially for women in their golden years. Understanding silent strokes can make the difference between years of independence and the slow loss of memory or mobility. Have you or someone you know ever experienced a sudden change in memory or coordination that didn't seem serious? Let us know in the comments. Your experience might help others. Section 2. Why older women are more at risk. Why are women more vulnerable to silent strokes as they age? It's not just coincidence or lifestyle. Science reveals that older women face a perfect storm of risk factors that quietly increase their chances of suffering silent strokes. And understanding these factors is the first step in prevention. 1. The estrogen shift after menopause. One of the biggest physiological changes women face is the dramatic drop in estrogen levels after menopause. Estrogen isn't just a reproductive hormone. It plays a vital role in protecting the heart and blood vessels. Before menopause, estrogen helps keep blood vessels flexible and healthy, improving circulation and reducing clot formation. But once estrogen levels decline, the protective effect fades. Blood vessels become stiffer, and the risk of plaque buildup, small clots, and high blood pressure increases. These changes don't cause sudden pain. They don't make headlines. But inside the brain, they quietly raise the odds of small, undetected strokes, the kind that chip away at memory and cognition over time. 2. Higher stroke mortality in women. You might be surprised to learn that stroke is the third leading cause of death in women in the U.S., and a leading cause of long-term disability. While men may experience strokes earlier in life, women often have strokes later, and those strokes tend to be more severe. More importantly, women are more likely to have non-traditional symptoms, including confusion, dizziness, fatigue, or fainting, which can be mistaken for other conditions or dismissed altogether. especially when the signs are subtle. This leads to delayed diagnosis, especially in silent strokes, where no typical warning signs appear. Number 3, longer life expectancy, greater cumulative risk. On average, women in the US live about 5 years longer than men. While this is often seen as a blessing, it also means a longer exposure to risk factors like hypertension, high cholesterol, type 2 diabetes, atrial fibrillation, more common in older women. All of these conditions quietly damage blood vessels and increase the chances of small, unnoticed blockages in the brain. The longer you live, the more these microdamages can accumulate, especially if not detected early. Number 4, underreporting and caregiving roles. Older women often prioritize caring for others over caring for themselves. They may downplay symptoms, miss follow-up visits, or assume that cognitive lapses are a normal part of aging. In fact, studies show women are less likely than men to report stroke-like symptoms, even when they do notice something unusual. Silent strokes take advantage of this mindset. They slip under the radar in women who are too busy or too modest to speak up. Number 5, social isolation and depression. As women age, many experience the loss of a spouse, reduced social engagement, or depression, all of which are associated with increased risk of stroke. Depression and loneliness aren't just emotional states. They affect the nervous system and vascular health, raising levels of stress hormones that can lead to inflammation and vascular damage. Over time, this chronic stress can contribute to conditions that make the brain more susceptible to silent strokes. So, what does this mean for you or a loved one? It means women over 50 should pay extra attention to subtle changes in their body and mind. A small lapse in memory, feeling off balance, or even changes in mood can be more than just getting older. They may be signs of something happening quietly and dangerously in the brain. But awareness changes everything. By recognizing these unique risks, women can start to take small, informed actions that protect their brain and body. In the next section, we'll look closely at the silent symptoms that often go unnoticed but shouldn't be ignored. Have you ever noticed a change in your memory, balance, or attention that seemed odd but not serious enough to mention? Leave a comment below. You're not alone, and sharing could help others. Section 3, the silent symptoms to watch for. Silent strokes don't come with flashing lights or sirens. That's what makes them so dangerous. Instead, they whisper in ways that are easy to miss or explain away. For women over 50, especially those juggling family, health concerns, and aging, it's all too common to chalk up small changes to just getting older. But those small shifts might be your brain trying to tell you something much bigger. 1, memory gaps that don't feel normal. Everyone forgets a name or misplaces their glasses. But with silent strokes, memory issues can become more patterned, frequently forgetting recent conversations, struggling to follow storylines in books or shows, losing track of time or appointments. These signs may not be dramatic, but they reflect damage to areas of the brain that store and retrieve information. Many women ignore this, thinking it's part of menopause or stress, but a silent stroke affecting the hippocampus or frontal cortex can disrupt short-term memory and decision-making. Number 2, trouble with balance or coordination. Have you noticed yourself stumbling more or feeling unsure on stairs or uneven ground? Silent strokes can affect small areas of the brain responsible for fine motor skills and balance. That means you may feel wobbly when walking, drop things more often, have a slight tremor or awkward movement. These symptoms are especially important to catch early because many people attribute them to arthritis, inner ear issues, or general aging, not brain injury. 3, sudden changes in mood or personality. Has someone close to you mentioned that you've seemed different lately? Silent strokes can subtly shift mood, energy, and emotional control. You might feel more anxious or irritable, have sudden bouts of sadness or fatigue, lose interest in hobbies or socializing. Because the brain's frontal lobe influences mood and judgment, even small damage from a silent stroke can alter how you respond emotionally to everyday situations. 4, difficulty following conversations or making decisions. Silent strokes can affect the brain's executive functions, the ability to plan, organize, and respond quickly. You may struggle to follow fast-paced conversation, have trouble processing new information, feel overwhelmed by choices or daily tasks. This might appear as slower thinking, or needing more time to make decisions, but it's a red flag, especially if this is new for you. Number 5, fatigue that feels different. Everyone gets tired, but if your energy levels suddenly drop and rest doesn't help, it might be more than just aging. After a silent stroke, the brain works harder to compensate for lost function, which can leave you feeling mentally and physically drained. Women may especially ignore this sign, thinking it's due to caregiving, stress, or poor sleep. But persistent, unexplained fatigue is worth discussing with your doctor. Number 6, changes in vision or spatial awareness. Have you bumped into furniture more often? Misjudged distances? Overlooked objects on one side? These could be signs of a silent stroke in the occipital or parietal regions of the brain, affecting how you interpret visual information or sense space around you. Again, these aren't dramatic enough to prompt a hospital visit, but they can slowly increase fall risk and reduce independence. Number 7, off days that feel too frequent. You know your body best. If you've started having more off days where you feel foggy, clumsy, or just not quite yourself, listen to that feeling. Silent strokes don't come all at once. Some people experience several over time, and each one chips away at cognitive or physical function. The takeaway? If you're experiencing any of these subtle but persistent changes, don't dismiss them. Silent strokes may not grab your attention, but they demand it. These micro events build up slowly, often without medical attention, until one day they result in a noticeable disability or set the stage for a major stroke or vascular dementia. In the next section, we'll take you inside the brain to see exactly what happens during a silent stroke and why these small changes add up. Have you noticed any of the subtle signs we talked about? If so, don't worry, you're not alone. Share your experience in the comments, or encourage someone you love to pay attention to these whispers from the brain. Section 4. What happens in the brain? To truly understand why silent strokes are so dangerous, we need to look inside the brain. What happens during a silent stroke is no less serious than a major one. The only difference is where in the brain it happens and how loudly your body reacts. Let's break it down simply and clearly. 1. A sudden interruption in blood flow. Your brain depends on a rich network of blood vessels to deliver oxygen and nutrients. When one of these tiny arteries becomes blocked, often by a small blood clot or fatty deposit, the surrounding brain tissue is starved of oxygen. This is called ischemia, and it can happen in just seconds. In a major stroke, the blocked vessel might feed a critical part of the brain, like the area controlling speech or movement, triggering dramatic symptoms. But in a silent stroke, the blockage affects non-eloquent areas, like parts responsible for memory processing or coordination. There's no slurred speech, no face drooping, just silence. But beneath that silence, something irreversible is happening. 2. Cell death in the brain. Without oxygen, brain cells begin to die, usually within minutes. These cells are not like skin or muscle that can regenerate. Once gone, they don't grow back. Over time, dead brain tissue can be seen on an MRI as white matter lesions or lacunar infarcts, little holes or scars where healthy brain once existed. These tiny infarcts don't seem threatening on their own, but the brain is a highly interconnected organ. When these micro damages accumulate, they begin to affect how the brain works as a whole. 3. Cumulative damage is the real danger. Think of each silent stroke as a missing brick in a wall. One or two might not make the structure fall, but over time, enough damage can make everything less stable. This cumulative damage is why silent strokes are strongly associated with mild cognitive impairment, MCI, vascular dementia, loss of balance and falls, depression and mood disorders. In fact, research from the National Institute on Aging suggests that silent strokes double the risk of dementia and often go hand in hand with memory loss in older adults. Why women's brains are especially vulnerable. As we age, the brain naturally shrinks slightly and loses volume. But for women, this process may be accelerated due to hormonal changes after menopause, which reduce brain plasticity, the ability to adapt and recover from damage. This means even a small lesion from a silent stroke can cause noticeable changes in how a woman thinks, remembers, or feels. Add to that the fact that many women already live with vascular risk factors like high blood pressure, cholesterol, or diabetes, and the effects of a silent stroke can be magnified. 5. Imaging reveals the truth. Because silent strokes have no clear symptoms, they often go undetected until someone undergoes a brain scan for another reason, such as memory testing, head injury, or unexplained confusion. An MRI or CT scan might reveal past silent strokes that the patient never noticed, often described as incidental findings. These discoveries are a wake-up call. They show that the brain has been under attack for longer than anyone realized. Sometimes, these scans also reveal brain atrophy, shrinking in areas damaged by multiple silent strokes. This is one of the earliest warning signs of vascular dementia. 6. Why this matters now, not later. The scariest part of silent strokes is that, unlike a major stroke, there's often no recovery phase. People don't go to rehab for them. They just go on unaware, until one day they can't remember their grocery list, or they get lost while driving a familiar route, or they start falling more often. But if silent strokes are caught early, through awareness, proper testing, and preventive care, their progression can be slowed or even stopped. We can't reverse damage that's already done, but we can protect the brain that remains. So now that you know what happens inside the brain during a silent stroke, it's time to learn why it happens and what fuels the conditions for these tiny attacks to begin. In the next section, we'll dive into the two biggest culprits: high blood pressure and cholesterol, both common in older women and both silent destroyers in their own right. Have you ever had a brain scan that showed unexpected white matter changes or mild atrophy? It may have been signs of past silent strokes. Let us know in the comments. Your story could help someone else take action. Section 5. The role of high blood pressure and cholesterol. If silent strokes are the invisible enemy, then high blood pressure and cholesterol are the invisible saboteurs that let the enemy in. They often cause no pain. They don't make you cough or limp. Yet quietly, year after year, they wear down your blood vessels, setting the stage for small strokes that most women never see coming. Let's unpack how these two conditions, so common in women over 50, are deeply connected to the rise of silent strokes. Number 1. High blood pressure, the number one risk factor for silent strokes. Also known as hypertension, high blood pressure is especially dangerous because it damages the delicate network of arteries that supply your brain. Imagine your blood vessels as garden hoses. Over time, if the pressure stays too high, those hoses begin to crack, stiffen, and narrow. In your brain, this means less flexibility in arteries, greater chance of small clots forming, microbleeds and vessel rupture, reduced oxygen to critical brain areas. According to the CDC, nearly 60% of women over 65 in the US have high blood pressure, and most don't realize how much it increases their risk of not just major strokes, but also silent ones. And because silent strokes don't cause dramatic symptoms, women with uncontrolled blood pressure may already be accumulating brain damage without knowing it. Number 2, the silent nature of hypertension. What makes high blood pressure so tricky is that you don't feel it. You can walk around with a reading of 160/90 or higher and feel totally normal, until the damage is already done. That's why it's often called the silent killer. For women, especially those going through menopause or managing multiple roles at home and work, blood pressure can spike due to stress, diet, or hormonal changes, yet go unchecked for years. And while many women monitor their weight, cholesterol, or glucose, blood pressure is often ignored until it's dangerously high. 3. Cholesterol, the other quiet culprit. Cholesterol by itself isn't bad. In fact, your body needs it to build cells and hormones. But when your LDL or bad cholesterol gets too high, it begins to clog and inflame arteries, including the tiny ones in your brain. Over time, fatty plaques can break off and cause tiny embolisms that block blood flow, narrowed arteries that reduce oxygen, increased blood pressure, and vessel stress. These changes don't cause pain, but they make your brain more vulnerable to silent strokes. The risk is even greater if your HDL, or good cholesterol, is low, which often happens after menopause. Estrogen used to help keep HDL levels higher. When estrogen drops, HDL often drops too. Number 4, women are less likely to be treated aggressively. Research shows that women, especially older women, are often undertreated for both high blood pressure and cholesterol compared to men. Doctors may assume symptoms are age-related. Some women avoid medication due to side effects or a belief that it's not that bad yet. Unfortunately, this passive approach allows damage to build slowly in the brain until one day it's visible as memory loss, imbalance, or confusion. 5. How these conditions work together. When both high blood pressure and high cholesterol are present, which is common, the damage multiplies. Here's how. Cholesterol clogs the arteries. High blood pressure weakens artery walls. The brain receives less oxygen-rich blood. Tiny strokes happen without warning. This toxic combination is one of the leading causes of vascular cognitive impairment in older women, a condition often mistaken for Alzheimer's disease. But here's the silver lining. Both hypertension and high cholesterol are controllable with lifestyle changes and, if needed, medication. 6. Simple numbers that save lives. Here are the target numbers most doctors recommend for older adults. Blood pressure, below 130/80 mm drag. LDL cholesterol, below 100 milligrams per deciliters, lower if you have other risk factors. HDL cholesterol, above 50 milligrams per deciliters for women. Knowing your numbers is a powerful first step. The second step is taking consistent action to keep them in range. Even a 10-point drop in systolic blood pressure can reduce stroke risk by up to 40%, according to the American Heart Association. 7. What you can do today. Check your blood pressure at home regularly. Don't wait for the doctor's office. Ask for a lipid panel during your next checkup. Reduce salt intake to help manage hypertension. Eat more fiber and healthy fats like avocado, olive oil, and salmon to support cholesterol levels. Walk 30 minutes a day. It's one of the most effective ways to lower both BP and LDL naturally. These small daily habits protect not just your heart, but your brain. In the next section, we'll talk about practical daily steps you can take to lower your risk of silent strokes, including one powerful change that requires no medication at all. Do you know your blood pressure or cholesterol levels? If not, this week is a great time to check. Share in the comments how you're managing these numbers. Your tips could help another woman start her journey to brain health. Section 6. Practical daily steps to lower risk. By now, we know that silent strokes are caused by small, invisible injuries to the brain, often from high blood pressure, cholesterol, or blocked blood vessels. But here's the empowering truth. You have more control than you think. Even in your 60s, 70s, or beyond, simple daily actions can dramatically lower your risk of silent strokes and even improve brain function that's already been affected. This section focuses on practical, realistic steps older women can take starting today without needing intense workouts or restrictive diets. 1. Check your blood pressure at home, regularly. Many people only measure their blood pressure at the doctor's office, but stress, caffeine, or rushing to your appointment can skew those numbers. Having a home monitor allows you to check your readings at consistent times. Spot trends early, share more accurate data with your doctor. Tip: measure in the morning and evening, sitting calmly. Keep a simple log for your next visit. 2. The 10-minute walk rule. If daily walks sound tiring or time-consuming, start with just 10 minutes after each meal. Research shows walking after meals helps control blood sugar. Light activity improves circulation to the brain. Regular movement lowers both blood pressure and LDL cholesterol. Even gentle strolls around the house or yard add up. The goal isn't to sweat, it's to keep blood flowing and vessels healthy. 3. Adopt the MIND diet. The MIND diet, Mediterranean intervention for neurodegenerative delay, is specifically designed to reduce dementia and stroke risk. Key points include leafy greens 6 eggs per week, spinach, kale, arugula, berries at least 2 eggs per week, especially blueberries, nuts daily, a small handful, whole grains and beans, fish 1 to 2 eggs per week like salmon or sardines, olive oil as your main cooking fat. At the same time, minimize butter, fried foods, and red meat. Packaged snacks high in trans fats or sodium. Good news. The MIND diet is flexible and enjoyable. Even partial adherence shows benefits for older adults. 4. Stay hydrated. It helps more than you think. Dehydration reduces blood volume and makes the heart work harder to circulate oxygen. This can worsen blood pressure and slow brain function. Women often drink less as they age, either due to a reduced sense of thirst or bladder concerns. But just 5 to 6 glasses of water a day can make a difference. Try this. Drink a glass of water with every medication dose, meal, or walk. 5. Practice brain brushing daily. Just like brushing your teeth, your brain benefits from a little maintenance each day. This includes reading or listening to audiobooks, doing puzzles or crosswords, learning something new, a craft, a song, a recipe, talking with a friend about something other than health or weather. Mental stimulation keeps the brain's connections active and slows cognitive decline, especially after silent strokes. 6. Manage stress. Gently, but consistently chronic stress raises cortisol, which increases inflammation and blood pressure. But you don't need hour-long meditations to fight back. Simple techniques that work. Deep breathing for 3 minutes before bed, listening to calming music or nature sounds, writing in a gratitude journal, gardening or tending houseplants. Bonus, these calming activities also reduce stroke risk factors like poor sleep and emotional eating. Number 7. Sleep like your brain depends on it, because it does. Poor sleep is both a symptom and a cause of silent strokes. Without quality rest, the brain can't repair itself or flush out toxins. Tips for better rest. Stick to a routine, even on weekends. Keep screens out of the bedroom. Avoid caffeine after 2 p.m. Use a weighted blanket or gentle white noise if needed. If you snore, feel groggy in the morning, or wake frequently, talk to your doctor. Sleep apnea increases stroke risk and is treatable. 8. Schedule your brain health like you do your hair. Put your brain health activities on the calendar. Monday, blood pressure check. Tuesday, try a new recipe from the Mind Diet. Wednesday, 10-minute walk and puzzle. Thursday, call a friend and chat. Friday, stretch and deep breathing before bed. By treating brain care like any other self-care routine, it becomes easier to stick with and even enjoyable. Small habits, big protection. These steps won't just protect you from silent strokes. They also improve heart health, reduce the risk of dementia, and enhance quality of life. The goal isn't to be perfect, it's to be consistent. In the next section, we'll look at when you should ask your doctor about silent strokes and what specific tests can help detect them early, even before major problems appear. Which of these habits are you already doing? Which one will you try this week? Share in the comments. Your daily routine might inspire another woman to protect her brain. Let's move ahead with Section 7, your medical checkup guide. Section 7, when to get checked and what tests to ask for. Silent strokes live up to their name. They often go unnoticed until it's too late. But you don't have to wait for symptoms to appear before taking action. If you're a woman over 50, especially with any history of high blood pressure, diabetes, or memory concerns, this is the perfect time to start the conversation with your doctor. In this section, we'll cover when to get checked, what signs should raise a flag, and most importantly, the specific tests that can detect silent strokes before they steal your independence. 1. When to talk to your doctor. You don't need to wait for a big event. These are times you should bring up your brain health. You've had noticeable memory slips or trouble concentrating. You've felt off balance more than usual. You've had a fall or near fall with no clear reason. You've been diagnosed with high blood pressure or high cholesterol. You're living with diabetes or atrial fibrillation. A close family member has dementia, vascular disease, or stroke history. Even if you haven't noticed changes, asking for a brain health check at your next physical is a smart move, especially after age 60. 2. Important conversations to have. Use phrases like, I've been reading about silent strokes. Can we check if I might be at risk? I've noticed small memory issues lately, and I want to make sure it's not something more. Can we talk about doing a brain scan or blood flow test? Being direct and informed shows you're proactive and makes it more likely your doctor will take your concerns seriously. 3. Tests that help detect silent strokes. While there's no simple silent stroke test, these exams can uncover signs of damage or risk. MRI of the brain, magnetic resonance imaging. This is the gold standard for detecting silent strokes. It can show old, healed strokes, even very small ones, white matter lesions associated with vascular dementia, atrophy or shrinking in areas impacted by past strokes. Ask for an MRI if you have cognitive concerns or are at high vascular risk. Carotid ultrasound. This checks for narrowing in the major arteries supplying the brain. Blockages here can raise stroke risk significantly. Echocardiogram or EKG. These test how well your heart is pumping and whether you have irregular rhythms like atrial fibrillation that raise stroke risk. Blood tests. Important labs to ask for. lipid panel, HbA1c, blood sugar control, homocysteine levels, linked to vascular damage. Cognitive screening tools. Simple memory and attention tests like the MoCA or MMSE help spot early signs of cognitive decline. Tip: if you're noticing brain fog or forgetfulness, ask for a baseline cognitive test now. It gives something to compare against in future years. Number 4. Insurance and access notes. Most of these tests, especially MRIs and cognitive screenings, can be covered by Medicare or supplemental insurance if you report symptoms or concerns. That's why it's essential to speak up about memory changes, balance issues, or family history. These aren't complaints, they're legitimate health clues. Number 5. Be your own health advocate. Doctors see many patients every day. You are the expert on your body. If something feels off, insist on further evaluation. Here's a short checklist to bring to your next appointment. I want to understand my risk for silent strokes. I'd like a cognitive screening. Can we review my blood pressure and cholesterol numbers? Should I get a brain scan based on my symptoms and history? Taking these steps now can give you peace of mind or catch problems before they grow. 6. What happens if a silent stroke is found? If your scan shows signs of a past silent stroke, don't panic. You've been given a second chance to protect your brain. Treatment might include adjusting blood pressure or cholesterol medications, physical or cognitive therapy if needed, closer monitoring of blood sugar, weight, and lifestyle, creating a personalized stroke prevention plan. In many cases, just knowing that a stroke has occurred and adjusting your care can prevent future, more damaging strokes. Early detection equals better outcomes. The key is not waiting for dramatic symptoms. Silent strokes don't announce themselves, they whisper. But the tools to find them are available. It just takes asking the right questions and advocating for your brain. In our final section, we'll summarize everything and offer inspiration for what consistent, long-term prevention looks like. Have you had one of the tests listed above? Or do you plan to talk to your doctor about silent strokes? Let us know in the comments. Your voice might help another woman take action. Here's the final section. Section 8. Bringing it all together. Section 8. The long game. Staying sharp and independent after 50. Living well after 50 isn't just about avoiding disease. It's about protecting the mind that carries your memories, your personality, and your independence. Silent strokes don't steal everything overnight, but left unchecked, they slowly chip away at what makes life rich. Your ability to think clearly, move confidently, and live on your terms. The good news is, your brain is resilient. With attention, intention, and a little daily care, it's absolutely possible to stay sharp and independent well into your 70s, 80s, and beyond. 1. Consistency over intensity. You don't need to overhaul your life to prevent silent strokes. In fact, radical changes often don't stick. What does? Small, consistent habits that support your brain day after day. A 10-minute walk is better than none. A half plate of leafy greens helps more than you think. Drinking water before your morning coffee counts. The magic is in doing it daily, not perfectly. 2. Create a brain-first routine. Think about your current routine. Now ask, is your brain part of the plan? Here's a sample brain-first routine for women over 50. Morning, take a walk plus drink water. Midday, eat a brain-friendly lunch, greens, healthy fat. Afternoon, do a puzzle or read. Evening, limit news, breathe deeply, go to bed at the same time. It's gentle, doable, and powerful. 3. Celebrate your brain like you do your heart. We often focus on heart health, but your brain deserves just as much love. Here are ways to celebrate it. Take a moment each week to notice what you've learned, remembered, or solved. Reflect on times you adapted, organized, or cared for others, all signs of cognitive strength. If you forget something, forgive yourself. That's human. What matters is continuing to engage your mind. 4. Redefine aging as growth, not decline. In many cultures, older women are seen as wise, centered, and clear-minded. You carry decades of lived experience. That's not something to fear losing. It's something to protect and pass on. Preventing silent strokes is not just a health goal. It's a way to honor your life, your memory, and your legacy. 5. Build a support circle for brain health. Whether it's a walking group, a book club, or a neighbor you check in with, staying socially and mentally active is protective for your brain. Reach out regularly. Even short calls count. Talk about health and memory with friends, not just aches and pains. Share this video or article to spread awareness. Remember, silent strokes thrive in silence, but together we can break that pattern. 6. Keep asking questions and learning. The most important habit of all, stay curious. Ask your doctor, read articles, try new things. The brain loves novelty, it grows from challenge. So whether it's trying a new recipe, learning a new breathing technique, or asking about brain scans, you're already doing the work of prevention. 7. Your brain is worth the effort. You've cared for children, partners, parents, coworkers. Now let's care for your brain, the part of you that remembers birthdays, makes jokes, solves problems, and connects names to faces. Silent strokes don't have to be your story. Not if you stay aware, stay consistent, and stay connected to your own health journey. A gentle reminder as we wrap up. Caring for your health is not about being perfect. It's about showing up for yourself every day. Even if you've already experienced a silent stroke, even if you've let your health slide in the past, it's never too late to take small, loving steps to protect your brain. Let this series be your starting point, or your reminder that your brain is worth the effort. We hope this journey has inspired you. Please share your thoughts in the comments. What changes will you make this week? What has helped you stay sharp over the years? Thank you so much for spending your time with us today. Your health, your brain, your future, they all matter. And every small choice you make is a step toward a stronger, more vibrant you. If this message spoke to you, please share it with someone you care about. Subscribe so we can continue this journey together, learning, growing, and protecting our minds with wisdom and grace. Wishing you peace, strength, and sharp thinking today and every day ahead. And in our next video, we'll dive into something just as important, foods that help reduce stroke risk in aging women. You won't want to miss these everyday ingredients that protect your brain naturally. See you there. And until then, take gentle care of yourself.